All right, good evening, everyone. Thank you so much for joining us tonight to learn about the North Carolina Medicaid Ombudsman Program. My name is Christy Moore, and I am the Family to Family Health Information Center Program Lead with the Exceptional Children's Assistance Center. We are recording tonight's webinar, and you will receive a follow-up email in the next few days with a link to the recording. We're going to try to do English and Spanish. We're experimenting tonight and also recording this in Spanish as well. And you'll also get a PDF of the slides, and for those who attended, a certificate of attendance. Our presenter this evening is Christy Rhodes, and she's the program manager with the North Carolina Medicaid Ombudsman. And I'm going to take just a quick moment to read a disclaimer before we get started. ECAC is providing this webinar as a public service. Reference to any specific product or entity does not constitute an endorsement or recommendation by ECAC. The views expressed by guest speakers are their own, and their appearance in a hosted webinar does not imply an endorsement of them or any entity they represent. Views, thoughts, and opinions expressed by presenters are their own and do not necessarily reflect the view of ECAC or any of its staff. I would also like to say that we welcome your questions, and we hope you have tons of them, and that we would love for you to put them in the Q&A. If you look at the bottom, there's a chat and there's also a Q&A. When Christy Rhodes is done presenting, we're going to go to the Q&A and go down the list and go through and answer all the questions. And we just want to ensure that Christy is able to get through all of her material, and that's why we welcome questions at the end. But as soon as you think of a question, feel free to go ahead and type that in the Q&A. And now I will turn it over to our presenter, Christy Rhodes. Christy?
Thank you, Christy Moore. I'm really excited to be here this evening. I've appreciated organizing this with another Christy, so I'm very glad to be here. And it was great to see all the county and town representatives that we have on the call this evening. We are a statewide program. I'm actually based in the Western region, though, so really excited to see some of those from closer up in the mountains where I am. So I am going to go ahead and get started. And as Christy mentioned, we will make sure to leave time at the end for questions and answers. And some of those, if I'm not able to answer today, I will look forward to the chance to follow up on to get some more information back to you. So let me go ahead and advance my slide. This is tonight's agenda. So I'm going to talk a little bit about getting help from the North Carolina Medicaid Ombudsman and what it is that we do if you're not familiar with us. I'm also going to take some time to talk about some North Carolina Medicaid Managed Care basics. A lot of that may be review for many people, but we want to make sure to go over these prior to turning it over to questions and feedback from you. So what is the North Carolina Medicaid Ombudsman? A lot of people are not familiar with the term ombudsman, and we totally understand that. What we're here to do is to be your advocate for quality care. So we are the Medicaid beneficiaries advocate. Very, very briefly, and I'm going to talk about this more in the presentation, but very briefly before I talk a little bit more about who we are, I want to take a moment to explain some very simple basics of NC Medicaid Managed Care and what that means. So North Carolina Department of Health and Human Services, or NCDHHS, has moved to North Carolina Medicaid Managed Care. And what we do within that is advocate for people with North Carolina Medicaid to help them get the care they need and to help them navigate this brand new environment by providing free and confidential services. So a little bit of a more in-depth look at what we do. Again, we provide free, confidential support and education about the rights and responsibilities people have under North Carolina Medicaid. We also connect people to other resources such as legal aid, social services, housing resources, food assistance, and other programs. We're really here to help Medicaid beneficiaries resolve issues so they can get the care that they need. And we do that through a number of ways. We do that by providing education, by doing our central role of serving as an advocate. We also refer and connect to other resources, for example. We conduct issue resolution. Another important role is that we track issues and monitor trends, and we communicate with North Carolina Medicaid on those issues and trends. So this is just another look of the services that are provided by the NC Medicaid Ombudsman. So again, we're here to inform. We provide information to Medicaid beneficiaries about their rights under NC Medicaid Managed Care or NC Medicaid Direct. We also offer guidance. So we offer members or beneficiaries guidance on filing appeals or grievances with their health plan. And we're here to investigate. So we investigate issues reported by members to help them to try to resolve those issues informally. And in that tracking role, as I mentioned earlier, we monitor. So we monitor issues members experience with their health plans and communicate with NC Medicaid to address those problems. And finally, once again, we refer. So we refer members to community services to support a wide variety of health-related needs. Our primary responsibilities are to educate, inform, and assist Medicaid beneficiaries about the following. So that's the transformation to NC Medicaid Managed Care, how to navigate the managed care system, which is new. It first launched with the standard or plans on July 1st of 2021. So this is still a new system. And the beneficiaries' rights and responsibilities under managed care. However, our role does not end there. We really seek to be true advocates for beneficiaries. So we conduct investigation, follow-up, and resolution. And we seek the best and most efficient outcome for the beneficiary through informal issue resolution with their health plans or with their providers, as well as other key NC Medicaid managed care entities. The Ombudsman staff also regularly communicate with the beneficiary concerning these efforts. So when someone contacts us, we open up a case for them, and we stay in communication with them as we work their case and work towards resolution. And we're also really proud to take a no wrong door approach. So we provide general information and referrals on many other issues. So the process for applying for Medicaid and NC Health Choice has not changed, but oftentimes people may call us and are unsure where to start, and we'll make sure they get to the right place. All applications go through their local DSS office, and we'll make sure that they get connected there. We don't handle private health insurance, but if someone has questions about ACA coverage, for example, we'll make sure to provide them with the appropriate resource to get them to the right place. And we also assist with referrals for other benefits, such as food assistance, housing resources, supplemental security income, and veterans benefits. I'm not sure if others on the call here are a part of the NC Care 360 network, but we do accept as well as send referrals through NC Care 360, for example. So these are some services that are not provided by the North Carolina Medicaid Ombudsman. The Ombudsman cannot provide legal advice or represent an individual with Medicaid in a managed care appeal or grievance procedure. We can provide basic information on that, but we cannot provide legal advice or represent an individual. Instead, the Ombudsman will refer clients in need of legal services to the appropriate organization. And that is based on where a beneficiary lives. So we provide legal referrals to legal agencies such as Legal Aid of North Carolina, Charlotte Center for Legal Advocacy, and Pisgah Legal Services. These agencies receive the referrals from the Ombudsman for members who need, or if they request, legal advice or representation to assist with appeals and other issues. Some people may ask, we know what the Ombudsman does, but how do we find you? So we are primarily operate a phone line. That is the best way for individuals to reach out to us. Our 877 number here is operated Monday through Friday from 8 a.m. to 5 p.m. with the exception of state holidays. If an individual reaches out to us, one thing that we like to note is that there's not a long phone tree to navigate. Someone simply selects one for English, or if they need Spanish assistance, the different option for Spanish, and are connected with an ombudsman who then opens a case for them and begins assisting. We're also available by email, and we have a lot of information online, including frequently asked question information. And in person, we definitely want people to reach out to us if they need an in-person option. We also look to do outreach events in person if you're part of an organization here that may be having a tabling event or another event where you'd like to have the NC Medicaid Ombudsman present. All right, so now that I've talked a little bit about who we are and what we do, I'm hoping to put this in a little bit more context by talking about NC Medicaid Managed Care basics. So as I've mentioned, the state did move to NC Medicaid Managed Care beginning July 1st of 2021. I mentioned that was the launch of standard plans. And I'm going to talk a little bit about the difference between the standard plans and the tailored plans. Many people have probably heard these phrases, may not be familiar with the exact difference between them. And so I'm going to go over this today as well as a few updates. The first update I want to go ahead and share before I even talk about what these plans are, because some people may be familiar, is that the tailored plan launch date has been delayed. And so in order to ensure that the nearly 150,000 people who will go into tailored plans seamlessly receive their care on day one, it was very recently announced that NCDHHS will delay the implementation of the NC Medicaid Managed Care, Behavioral Health, and Intellectual Developmental Disabilities tailored plans. Beneficiaries who receive enhanced behavioral health services not provided by a standard plan or those who are tailored plan eligible will be transitioned to tailored plans on the new launch date of October 1st, 2023. And this is a very recent change. This changes my presentation somewhat this evening, and this is a recent change that some on the call may not be aware of. So I wanted to go ahead and begin this section with this slide. I can also paste into chat or Q&A the associated press release that provides some more information on that. One other thing I wanted to go ahead and address, because I know that there have been some questions about it, perhaps from your group or other people that we've presented to in the past, is an update on the 1915I option. So North Carolina Department of Health and Human Services continues to work with CMS to identify an appropriate implementation date. I am not able to provide an implementation date at this time. But for those who are unaware or would like more information, this program will help beneficiaries remain in their homes and community-based settings through the following services. So that's respite, individual and transitional supports, community living and supports, community transition, and supportive employment. So now that I've gotten kind of those two updates out of the way, I want to talk a little bit more about the differences between standard plans and tailored plans. because you may be working with beneficiaries or you may have beneficiaries in your families who have questions about the differences between these. I'm going to go over the major side-by-side comparison, and then the next slides will have the actual names of the plans and some maps that should be useful as you come into as you come into contact with these plans or have questions about them. So with standard plans, they provide integrated physical health, behavioral health, pharmacy, and long-term services and support to most North Carolina Medicaid beneficiaries. They also provide other programs and services that address other unmet health-related resource needs. The standard plan, for example, may offer additional value-added services or wellness programs, for example. Some of those that I've seen referenced have been Boys and Girls Club membership or assistance with certain healthy foods and vegetables. The enrollment with a standard plan is based on the residential county. And so that is the county where the beneficiary lives. Depending on their residential county, and I know we have a pretty good statewide representation this evening, so the map will hopefully make this clearer. But depending on the residential county, beneficiaries can choose from either 4 or 5 standard plans. Tailored plans, on the other hand, will provide the same services as standard plans, as well as additional services for individuals with a mental health disorder, substance use disorder, intellectual or developmental disabilities, or traumatic brain injury, and state-funded services. The tailored plans also differ because the enrollment is based on the administrative county. And so that is the county that manages the beneficiary's Medicaid case. There is only one tailored plan per county. So if a beneficiary's administrative county moves to a different service area, they will move to the tailored plan that offers services in that county. So in taking a little bit of a deeper look at standard plans, again, most Medicaid beneficiaries in North Carolina are enrolled in standard plans. And the following standard plans are available statewide. That's AmeriHealth Caritas, Healthy Blue, United Healthcare Community Plan, and WellCare. There is also Carolina Complete Health, which is only available in regions 3, 4, and 5. So that's the orange, red, and dark green regions in the more central and eastern part of the county, or excuse me, state. The tailored plans, on the other hand, there are only 6 tailored plans, and only 1 tailored plan serves each county. The tailored plans are operated by the LME MCOs, Alliance Health, East Point, Partners Health Management, Sandhill Center, Trillium Health Resources, and VIA. So the tailored plan service areas are based on the counties that manage the beneficiary's Medicaid case or the administrative county. So if someone was in Buncombe and part of VIA and their administrative county moved to Mecklenburg, they would switch tailored plans to Alliance Health. And again, this is what the tailored plan provides. I know that we have a lot of questions about tailored plans. We've talked briefly about the delay, but even with that, people may ask, what is it that the tailored plan does? So again, the tailored plan integrates physical health, pharmacy, and enhanced behavioral health services for beneficiaries with mental health needs, severe substance use disorders, IDD, or TBI. It also provides services for innovations and TBI waiver beneficiaries and waiver waitlist beneficiaries. The tailored plan will also provide those additional added services such as wellness programs that I mentioned earlier. And this is a big change. The tailored plan will also provide non-emergency medical transportation. So this is something we've gotten some questions about in the past. So the tailored plans, once they launch, if an individual is in a tailored plan, they would reach out to the tailored plan directly to schedule their NEMT or non-emergency medical transportation for their Medicaid covered services. Many individuals, if they are in Medicaid Direct right now and receiving services through the LME MCO, are likely accustomed to contacting their local county DSS for those.
Hey, Christy, I don't mean to interrupt you. I kind of
Yeah.
do, but
Yeah.
would you mind just giving an example for folks who may not know, like what's an example of non-emergency medical transportation?
Yeah, that's a great question. And I kind of concentrate on this one because our last monthly webinar was about this. So if someone is going to the doctor's office and they do not have their own vehicle, and so it is needs based. It is based on what the beneficiary needs. But individuals, if they are in Medicaid Direct right now, would contact their local DSS to schedule a ride, for example, to their primary care provider or to their specialist. This talks about carved out services here. So dental is a carved out service, but they would still contact, if they go into a managed care plan, they would still contact the managed care plan to schedule dental. Mileage reimbursement is also available. So the important thing about this, and I'd be happy to provide more information if people have specific questions, but the important thing about this is it has to be scheduled in advance, even if it's mileage reimbursement, at least with my experience with the standard plans. So people do need to reach out and request that transportation. If they're in a standard plan and in Healthy Blue, for example, they'd be reaching out to Healthy Blue to schedule it. If they're in Medicaid Direct, they'd be reaching out to their local DSS.
And what do they consider in advance?
2 days notice is what the standard plans need to provide. If people have more advance notice, that is definitely, I think, preferable. This is a issue we get a lot of questions about. If someone's having issues with their NEMT, that's a perfect time to reach out to the Medicaid Ombudsman. So, does that answer all the questions about that for right now? I'm happy to take any specifics.
Yep, no, we're good. We'll let you finish.
Okay, thank you. No, this is one we get a lot of questions about, so really glad to focus in on that if people would like. I would say, before I forget, if I don't come back to it later, if someone's having issues scheduling an NEMT, or if they schedule it but they may have like a no-show or their ride gets canceled, for example, that's a good time to reach out to the North Carolina Medicaid Ombudsman for some possible assistance with that. Kind of jumping back in here, the tailored plan also provides tailored care management. So though tailored plans have been delayed, tailored care management actually did launch on December 1st of last year. And I do have a slide that talks a little bit more about that if people have questions. And it will also provide state-funded services. So once again, tailored care management did actually launch on December 1st for eligible beneficiaries. And what tailored care management does for those eligible beneficiaries is designate a single care manager who is supported by a multidisciplinary team to provide integrated care management that addresses the beneficiary's whole person health needs. Tailored care management is only available for beneficiaries in tailored plans, or right now I should say those individuals going into tailored plans, or NC Medicaid Direct. It is not available for beneficiaries enrolled in a standard plan. However, those who are in standard plan do have care management options. It's just not tailored care management. Again, it launched on December 1st. It really focuses on that whole person perspective and helps address the physical health, pharmacy, and behavioral health needs. Letters were mailed back in November to individuals who were eligible for tailored care management and their authorized representatives with the contact information of their tailored care management provider. So if people have questions about that, if they have reached out to the LME MCOs and tailored plans and have questions about that and that they've not been able to resolve it, that is also a time that they can reach out to the Ombudsman for some additional assistance. And again, beneficiaries can change their tailored care management provider by calling their LME MCO. A quick note on the traumatic brain injury waiver. We often get a lot of questions about this. And so Alliance is the only tailored plan that provides the TBI waiver services. And at tailored plan launch, those TBI waiver services will only be available in the following counties: Cumberland, Durham, Johnston, and Wake. However, the TBI waiver may expand to other counties and service areas later on. So even though I know tailored plans have been delayed, we often hear from individuals, what should beneficiaries do to prepare for tailored plan launch? This is also just some good guidance for beneficiaries in general, not always in connection to tailored plan launch. So based on questions that we get pretty frequently. First and foremost, I would say make sure your local Department of Social Services has your current mailing address, phone number, and email address to make sure you get important information. So even though we have gone through and are going through this change to North Carolina Medicaid Managed Care, all of that information begins at your local DSS. So if you are switching counties or moving counties and DSS hasn't been notified, or just changed your mailing address or phone number in general, you may be missing important information. You can call your local DSS to update your information. And if you have an enhanced ePass account, beneficiaries can actually update their information online without having to contact their local DSS. And there's some information that I know you'll receive the slides. There's some information and links reported on the slide. It's also to report any changes such as income or a change in household size that may impact the type of coverage you qualify for. This one sounds really simple, but very often we hear from people that they think they got a notice, they may have lost it, or they may have thought it was junk mail. It's really important to check your mail for notices. Again, tailored plans have been delayed to October 1st, and we do know that there will be a delay notice with more information going out about that soon. If you haven't already and you may be going into a tailored plan, also talking to your providers about contracting with your tailored plan. We are not the provider ombudsman. I think my next slide has some more information on that. So I don't know if we have any providers on the call today, but beneficiaries can talk to their providers and find out, have you contracted with the tailored plan or do you intend to? And provide some more information on that. We do often hear from providers, so I always include this slide. There is a separate provider ombudsman, and I have highlighted their information here. Our program is not trained to assist with issues such as provider billing or credentialing. However, there is a lot of information out there available to providers, and I wanted to highlight that in case we have anyone on the call today that is a provider. We often get questions about this, and we are very limited in what we can provide on that. If you are a beneficiary, though, and you're experiencing a billing issue on the other side, like you've received a bill and you shouldn't have, that's definitely a perfect time to reach out to us. So I know that anyone here is aware of the North Carolina Medicaid Ombudsman outreach, but I also just wanted to put a quick plug here about digital versions of our outreach materials. They're all available in English and Spanish. We have brochures, we have palm cards, we have frequently asked question sheets. All of those are available online. But you can also request printed outreach materials in English and Spanish to be mailed to your organization by emailing us. If you are here with an organization or if you work with an advocacy group and you'd like to have copies, we would definitely love to get copies to you. And finally, just like we're doing today, we provide presentations on NC Medicaid Managed Care and the Ombudsman services available in English and Spanish. And I know in terms of talking about tailored plans today and an updated tailored plan timeline, I may be providing some limited information due to the delay. However, we'd love to come back in the future to provide more information to you or to any other organizations who are interested. And finally, we're also pretty active on social media. You can always follow along with us and find out about updates, or we do a monthly webinar series ourselves. Like I said, last month, we focused the topic on non-emergency medical transportation. We have one next week, and we're going to be talking about some of this information, but also healthy opportunity pilots with DHHS. So the topic is always changing and being updated based on changes or new information, and we'd love to have you attend those. And finally, I know that I've seen kind of the Q&A popping up, so I want to turn it over and make sure we have plenty of time to go through some of these. I'm going to briefly stop sharing my screen, but I can always pull up some of the slides to reference if needed.
Okay, that is perfectly fine. It can be the Christy and Christy show for a little while. Wonderful. Okay, yes, we have lots of questions in the Q&A. I love to see that. I know there's a couple sprinkled in the chat. I'm going to go to the Q&A first. Let's see. Oh, all right.
And Christy, thank you for grabbing my acronyms. As soon as I say an acronym, I regret it. So I see you put that in there. Thank you.
I tried to keep up with you as best I could. And I'm like, wait, LME, local management. I always second guess.
Sorry.
Okay, so first question, is Trillium a tailored plan provider?
Yes, Trillium. Let me actually, I stopped sharing my screen and I probably shouldn't have. Let me pull up the map of the tailored plans just so I have that.
And that was asked at the very beginning, so maybe that question was answered. So the whole question is Trillium a tailored plan provider? How do I know that is what will work for both my children? All their services will be taken by this plan. Is a managed plan better than a tailored plan?
These are really good questions. I think what is important with everyone's situation is specific on what they're going to be in. So I'm not sure if these individuals, some of the children may already be in a standard plan, or if right now they're in NC Medicaid Direct and on an innovations waiver, for example. There are going to be some groups that are mandatory in moving to a tailored plan. That's why it's so important to pay close attention to these notices, reach out to the tailored plan to find out what providers are in network. This is also a good chance to lean on that tailored care manager, since that program has already launched, to find out more about their services. There should be no changes in the way that your children say that they are going into a tailored plan. There should be no changes in the way that they receive their services between now and October 1st. Because of that delay, there are not any changes. I'm not sure if that answers the question. I can give an example. Before the delay, we would have calls from people who had received a tailored plan notice and want to know what that meant for them. A lot of our work is done by helping kind of accompany and guide individuals through this process. So maybe they've reached out to the tailored plan, but their questions are still unanswered. So maybe we can call back on a three-way call and try to be there to advocate and help ask the important questions. And that goes into our monitoring issues and trends too. We're really here to be responsible, to be an advocate for the beneficiaries and try to help make sure these questions are answered.
Mhm. And you know, whether, and you kind of answered this already, Christy, but whether a managed care plan or standard plan is better than a tailored plan depends on the needs of the people
Absolutely.
who are going to be in those plans. And it's my understanding, I'm no expert, Christy, so put me in my place,
You're good.
is that the tailored plans are designed more for people with more behavioral health, substance abuse needs, and is more tailored to, is that right? No?
No, yeah, absolutely. I should have mentioned there's an entity. I don't know if this individual or other individuals on the call have contacted the enrollment broker before. So the enrollment broker is the entity responsible for that choice counseling.
Okay.
And what I can do, I can pull up some links that might be helpful to talk about the differences between the services that are only available in, or will only be available in a tailored plan.
That would be great. And how about this? How about you send this to me and I'll send those
Absolutely.
email. That way everybody will have all this stuff together. Is that good?
Yeah, absolutely. This is it's kind of hard to talk about right now since we do have that delay. Like we
Right.
know that what the delay happened to help continue to build up that provider network so that they can ensure that all beneficiaries on day one um, have as seamless of a transition as possible. But I can definitely share that for this individual or any others. It kind of depends on the types of services that you need. If you're on innovations waiver, um, the different circumstances involved.
Okay, perfect. We have 32 questions.
Oh my goodness.
Real quick, what is NC Care 360?
Yeah, so that is that's a statewide system. I can provide a link to that, but it's a really it's mostly a software platform, and what it does is it helps individuals connect to different services. So someone reaches out to us and say, we know that they identify needing emergency food assistance. We can send out referrals to food pantries in their area. And that way, whoever picks it up and runs with it is going to reach out to that individual directly rather than kind of the old way of doing it where an individual gets, here's a list of phone numbers, have at it. It makes that direct kind of closed loop referral. And it is a statewide system.
Okay, great. Thank you.
Yeah.
Does the tailored care plan support individuals in group home setting?
Um, I wonder if that's about tailored care management or tailored plans. My answer would be yes, likely. I would probably want to know some more specifics to be able to give a full answer on that.
I guess they're saying, is it available to people that are if they're in a group home, is my interpretation of that, Peggy. But you can follow up with that and I can come back to it. Why is Mecklenburg County separate from the surrounding counties for tailored plans? We have a provider we'd like to use in Mecklenburg County that has been approved for partners, but not Alliance. Alliance keeps rejecting their application. It makes it difficult to get services.
It's the way it's set up based on the way the catchment areas are, but this would be a potentially a question to bring, if that provider is having issues, the provider ombudsman would be a really great resource for them. I could also see how to help support the beneficiary aspect side of this and see if it's something that we might be able to help connect on a certain level, but that may very well be something a provider ombudsman could assist that provider with directly. Providers can be part of multiple tailored plans. So it's not as though that they have to only be with partners and therefore they can't be with Alliance. I'm not sure why that would get rejected, but that's a really great question.
Okay, so Peggy said yes to, I think, my interpretation of her question. Hold on. Yes. Are tailored plans available to people who are in group homes? Can somebody in a group home have a tailored plan?
It's very likely because they are probably receiving those enhanced behavioral health services, like in the group home setting, for example, if I'm interpreting this correctly, that they would likely be part of a tailored plan.
Okay, thank you.
What I can do is share that side-by-side comparison, and I think that would help provide a little bit more information on that.
What would a wellness program provided by the tailored plan look like?
Um, I think we can expect them to look a lot like the standard planned ones. So, I know with the standard plans, like I was mentioning, they may offer incentives for like healthy fruits and vegetables or um, Boys and Girls Club memberships and things like that. I don't know that I have specifics on what the Taylor plans are offering, but that would be those kind of value added things that I would anticipate.
Okay. Let's see. Whoop. For tailored plans, is there only one MCO per county? I can answer that, yes.
Yeah, there's only
Are you
well,
able
and
to
that's something I should mention. Right now we have people who are NC Medicaid Direct and they're receiving these enhanced services through the LME MCO. Once tailored plan launched, the idea behind that is that we'll integrate those. So sometimes people ask what is happening to the LME MCOs. Um, at that point, the Taylor plan will be providing both the physical health care
Mhm.
and the behavioral health care or the innovations waiver, for example.
Yeah. And then she asks, are you able to choose an MCO provider other than Alliance Health? And it's no, yeah.
No.
Your MCO is the county you live in. Yep.
Yeah.
Okay, next question. Is the tailored plan going to cover ABA therapy as it's covered under Medicaid Direct right now?
So I would say an important note about standard plans and tailored plans in general is that clinical coverage policies do not change. So that should be a yes to that.
Okay. How could we request a refund per mile?
Yeah, if that individual is currently in NC Medicaid Direct, they would reach out to their local Department of Social Services. If they are already in a managed care plan, they would reach out to that managed care plan. The plans, I know more about that since we focus in on the managed care issues. And I know sometimes the DSS offices may have different practices with mileage. But the plans usually you will call them, you'll make the request, like I'm going to my primary care provider next Thursday. They'll actually give you a confirmation number and you will receive in the mail for most of them, a form to complete. You send that back to request reimbursement. And if anyone is having issues with that, or if they're not sure where to start with that, they can definitely reach out to us for some guidance and kind of accompany through that process and getting to the right place.
Okay. Also, mileage, let's see. Does non-emergency medical transportation change what we currently get mileage reimbursement?
I am not sure how to answer that because I'm not sure what someone is getting currently, if that's already been coordinated through Medicaid. Again, this is only for Medicaid covered services to a North Carolina Medicaid provider.
Okay. Sorry about that. So if you were getting one amount, I'm not sure if it's
Yeah.
let's see.
Oh, I see if there's a follow-up question to that.
We presently go through DSS, will it be different?
If you are moving to a tailored plan, yes, it will be different. Starting October 1st, it will be different.
Somebody says, I may have missed this earlier. What department or entity houses NC Medicaid Ombudsman? Is it under DHHS?
Yeah, so we are a contract through NC DHHS, but we are a separate entity.
Why will the tailored plan PBI waiver service not include Mecklenburg County if Mecklenburg County is also on Alliance?
That that's a great question. That I don't have an answer to that other than those are the counties that it's offered on. And Mecklenburg right now is not one of those. It's Cumberland.
It's not, but it's being discussed that it will be that in Orange, right? I think it's Orange and Mecklenburg that they're considering adding. It's on their website.
Yeah. Oh,
it's
okay.
on Alliance's website.
Oh, great.
That just saw it. So coming soon, Mecklenburg County near you. It's coming. It's slow, but it's getting there.
Yeah.
Okay. So for Medicaid Direct, in parentheses, foster children, will they direct non-emergency medical transportation reimbursement to the tailored plan starting on April 1st, or will they continue to DSS? So Medicaid Direct.
So there are no changes starting on April 1st. Probably the big takeaway I would say is with anything tailored plan related, there are not going to be any changes now until October 1st, given the delay. If you have an individual who's remaining in North Carolina Medicaid Direct, they would still go through their local DSS. And for right now, anyone who's not in a standard plan would still go through their local DSS for right now.
So it sounds like, and Ashley, forgive me if I'm misinterpreting, that maybe they're getting a reimbursement amount going through their DSS, right? Now they're wondering if they have to start scheduling through the tailored plan. Will that end up being a different amount, or is it all going to be the same reimbursement?
It should be the same reimbursement amount. Now, the process may be different because I know when we had the initial launch on July 1, I had some callers who the local DSS may have done it more, like they may have had a partnership with like a gas station near them, for example, and done like a voucher type program. What I've seen through the standard plans is reimbursement. So that it may be, I have seen some questions about it being a different process, moving from local DSS to a managed care plan.
Okay, will everyone that is currently on Medicaid Direct be switched over to a tailored plan?
No, they will not. So most people who are dual eligible, for example, most people who are on Medicare and Medicaid, unless they're in a waiver program, innovations or TBI waiver, I should say, will remain on Medicaid Direct.
And Cap C folks also.
Yeah.
Right.
Oh, sorry, Cap C moved to
is in Medicaid
Direct. Yes, Medicaid Direct. Yes.
Yeah.
I wanted to make sure I didn't include that. I want to make sure I didn't include that. People who are in family planning will stay in Medicaid Direct. It is a most people right now are in the standard plans. The next phase is tailored plans, and that's another group of individuals. But there will be some people who are remaining in North Carolina Medicaid Direct. That's why it's so important to pay attention to the notices that are received when this delay notice or when new notices go out, because people's circumstances may be different, and it can be hard to guess at that. It really needs to go by the notice or talking to the enrollment broker, for example.
I saw a chat pop up, so I'm just going to answer it real
Sure.
quick. Somebody asked about, what is the innovations plan? And the innovations refers to a Medicaid waiver for people with intellectual and developmental disabilities. So North Carolina has 2 Medicaid waivers that cover children. One is Community Alternatives Program for Children, which is a waiver for children who are considered medically complex or medically fragile. And the other one is the Innovations Waiver. And the Innovations Waiver is a birth to death waiver. However, because of the wait list, only about 10% of the people who are on the Innovations Waiver who actually have a slot are children. Everybody else is an adult because of the large wait list. But that's what the Innovations Waiver is, a Medicaid waiver. Let's see. Okay, so a run-of-the-mill family whose kid needs counseling or medication for mood, ADHD, etc., do they have to switch from standard to tailored plans?
So some behavioral health services are offered through the standard plans. It's those enhanced behavioral health services that are not. So it would depend on the services that they're receiving. If they're in a standard plan and they're having issues accessing those right now, that's a great time to call the North Carolina Medicaid Ombudsman so that we can help with those next steps.
Okay, great. Let's see. In 2018, I was told by the local health department that my daughter did not have the right to access to behavioral therapist because she was just a legal permanent resident and not a citizen.
I would probably want more information since that's such a specific issue. I'm wondering if she was on health choice instead of full Medicaid, and so maybe she was trying to access something through an LME MCO and needed to go through Beacon instead. I have had cases with similar issues, but if she has Medicaid and she's having trouble accessing any care whatsoever, sorry to be a broken record with this, but that would be a great time to reach out to us so we can get some more specifics on what's happening.
Oh, perfect. That one-on-one support is fantastic. Can the Ombudsman office help with application questions?
We cannot. So applications and eligibility are out of our scope. If someone doesn't know where to start, we'll point them in the right direction, but we cannot answer application questions. If someone's got a denial, we can connect them to legal services, but we really can't address those.
Will the tailored plan being delayed, who will this affect to obtain OTC over-the-counter medicine? This is very important for me due to my son's medical condition.
Yeah, I would say if I'm guessing maybe your son is in North Carolina Medicaid Direct right now, and so he should not see any changes to his services until October 1st. If I would probably need some more information on that question, but that's kind of my big takeaway for right now. There is the tailored plan delay. If your child is in North Carolina Medicaid Direct right now, they should get their services the same way they do right now until tailored plans launch in October.
Okay, Gabriella asks, how can I apply to that 360 program and the tailored plan since I'm an individual with a mental disability that has a traumatic brain injury?
Sure. So I can provide a link. So NC Care 360, you can go there as an individual and put in an assistance request. It's very similar if you've utilized like the United Way's 211 line. It's just done through like an online referral instead of perhaps talking to someone by phone. And the tailored plan determinations are based on the services that you receive. Sometimes it's diagnosis or the services that you receive. So I would have to know a little bit more. If you're on North Carolina Medicaid Direct right now and you need assistance, it would probably, and you're not getting the services you need, it would be contacting your LME MCO to learn about more services that are available to you.
Got it. Okay. Sorry, I was reading pop-ups in the chat. So
Sorry.
basically, if she has questions about like, am I going to be on the tailored plan if they haven't gotten a notice in the mail or whatever, is that something where she could call the ombudsman and you guys could help her find out?
Yeah, we would probably do a three-way call to the enrollment broker.
Okay.
I just want to note that if they're trying to access services right now, with tailored plans again not launching until October, there should be a way to make sure that they're accessing services in the meantime, though. And if they're on NC Medicaid Direct, that would likely be through the LME MCO, depending on what type of, if it's behavioral health or services that are trying to access.
Okay. We recently got an email about North Carolina Medicaid expansion that has passed by the legislature. Can you explain some more about that?
I wish I had all the answers on that. I know that we're waiting for next steps and more information.
Yeah, I know that NC Child has put out some information on what that means and what that will mean. I can try to find something to put in the follow-up email.
Yeah.
Let me write that down. Because if I don't write it down, I forget. Because I'm getting to that point in my life. Okay. Do tailored plans limit the hospitals/clinics that you can use? As in, I'm only able to use the hospitals in my region.
So it would be important to know if the hospitals are in network with your tailored plan. So, with emergency services, if you're experiencing an emergency, that network question is not as important. I have worked with some people who encounter after the fact billing issues, and we try to work through those. But you would want to find out if the hospitals or clinics in your area are contracted with the tailored plans. And that is ongoing. That is all the tailored plan sites, and actually at the NC Medicaidplans.gov site, there's a really comprehensive directory, but we know that people are still in the process of contracting.
If you have a child with an IDD diagnosis, is it best to start by signing up for the tailored plan care management plan and then be transferred to the tailored plan in October?
So if your child was eligible, you should have received a notice about Taylor Care Management if they were eligible in about mid-November, they were mailed out. If you did not get a notice and you think you should be eligible, you can contact the future tailored plans, the LME MCOs right now for more information, see what you're signed up for. And if you're having trouble with that, you can definitely reach out to the ombudsman for help with steps on that.
Great, thank you. How do we find out if we are on the tailored plan?
That's a really good question. You can contact the enrollment broker. This goes back to making sure that DSS has your up-to-date information. So, you should be receiving notices. You should have gotten a notice earlier this year about the tailored plans, and then there will be a new notice going out about the delay. So that is the most important way to find out kind of your enrollment status or your future enrollment status. And
I believe, hold on, let's see. I think we had a little follow-up to maybe one of the questions. Somebody in the previous question that I asked said we've never signed up for Medicaid at all. They're new to the area. So I guess they're asking about like, what is all this stuff?
I'm sorry, which question was that in response to?
I think that was a response in if you have a child with an IDD, there you go. Yep. If you have a child with an IDD diagnosis, is it best to start by signing up for a tailored plan? I guess they're planning on applying for Medicaid is what it sounds like.
Okay.
And they're trying to figure out, they have a child with IDD, where do they go?
Sure. Okay, so what could happen potentially is once they're accepted for Medicaid, they may be like auto-enrolled to a standard plan. And if they need enhanced services through the tailored plan, once tailored plans launch, right now there's a request to move to Medicaid Direct. So if someone is in a standard plan, but they need a service that's not available in a standard plan. So, one we might get is like child and adolescent day treatment services, which they would need to go through an LME MCO for right now. There is a request to move to Medicaid Direct. So if you apply and your son's assigned to a standard plan, but he's not able to get the services he needs through it, there is a request process to move.
And I just also wanted to say, since you're new, I don't know if you're just new to the state or even if you're new to the country, also apply for the innovations waiver if you have a child with an intellectual and developmental disability. Sorry, Angie, I'm talking too fast, I know. I just put my email address in the chat. So if anybody has questions about Medicaid waivers, please feel free to email me and ask your questions. That's what I do. I'd love to help answer. And if I don't know, if you ask me a hard question and I don't know, I will find out. Let's see. I am in the process of getting Medicaid for my 20-year-old son with IDD. I have set up an account with ePass. Why do I have to answer lots of questions about the rest of my family members, such as income, etc.? My son has been on the innovations waitlist for 15 years and he's getting close to being accepted into innovations.
Yeah. Unfortunately, the ombudsman services do not get into the scope of applications and eligibility. If you're not getting the answers you need from DSS, we can try to help with some informal issue resolution, getting you to the right person, or making sure that you're getting the call back on that. If you get a denial, we can help you get a legal referral. But when it comes to answering application questions, that is not within our scope.
Is that something the enrollment broker could help with or no?
No, the enrollment broker is really there for choice counseling with the plans themselves. Definitely if you're not getting your questions answered through DSS, like if you're not getting callbacks or if you're just not getting the information you need, that might, we have point of contacts at the DSS office, and sometimes we can help reach out to get specific questions answered, or help relay a message so that you can get to the right person if you're having trouble getting through. But as far as answering why those questions are being asked or eligibility in general, we're not able to assist with that.
Okay, thank you. Okay, my son has tailored care plan letter, but still no case manager. We have checked with VIA a couple of times. Does this matter?
Um, so he should have someone assigned to him. Um, you know, the assignments were supposed to go out on the November letter. So if you've called Devia and you're still not getting the answers you need on that, that is something we definitely want to assist with. We can't make the change directly. We can't make the update directly, but as I mentioned, a lot of our work is done through informal issue resolution. We can help accompany someone through the process. We can make three-way calls together. We can escalate issues as we need to if we're unable to resolve them. By that I mean escalating it to like DHHS, for example, for some extra follow-up and help if we're unable to resolve.
The second part of her question is also he may get cut from Medicaid because of age 21 once COVID emergency is done, which I don't know.
Yeah.
Will being in a tailored plan help him not be cut? He really needs these services.
This also gets more into the eligibility information. I would just say, as we expect redeterminations to resume, to keep an eye out for that information coming from DSS about redeterminations for eligibility. And if you get a denial, or if you get terminated, that is where we would make a referral to legal services, or if for some possible additional assistance.
And then she asked, was there Medicaid expansion passed? So yes, there was. And how would that affect him and other young adults who are not on disability?
So right now, and this is a question we get a lot when someone moves from like an expansion state, like if they're moving from Ohio and they want to transfer their Medicaid, and we have to let people know you can't transfer Medicaid from state to state. So, I think we're hoping that Medicaid gap would reduce this problem, but it's again in the area that we don't work on with eligibility and applications. I do expect as the public health emergency and continuous coverage unwind that we will probably be having some more information on this on our monthly webinars and more training on our staff to be able to assist people in getting them to the right place soon.
Yeah, I think it's still so new, and I am going to look for some good information on Medicaid expansion and kind of what that means for families to try to include.
Yeah. And if someone, if someone's moving here, it may be worth talking to a navigator too, if they're not eligible for Medicaid right now, talking to, we often make referrals to the North Carolina Navigator Consortium to see if someone may be eligible for an ACA plan. That may not be what this individual is asking for, but that's a referral we provide pretty regularly.
Is Medicaid Direct going to continue, and how can we remain in it?
Yeah, so Medicaid Direct, as I was talking about earlier, will continue, but it will be after October 1st for a smaller population of individuals.
For tailored plans / innovations waiver, do you file a grievance through Alliance Health or do you file it with the Ombudsman?
You would file that through Alliance Health.
How do these plans coordinate with individuals, the beneficiaries that have private insurance?
Yeah, so we get calls on this. Usually someone may have their private insurance primary and Medicaid secondary. Medicaid is always the payer of last resort. So the important thing about managed care, not the important thing, but one important thing is that it creates a provider network. So individuals who may have been in North Carolina Medicaid for many, many years, may have seen their provider and they accepted North Carolina Medicaid, commonly referred to in the past as fee-for-service. Then if they are now in a standard plan, they need to make sure that provider accepts their standard plan. Like Healthy Blue, for example, is their provider accept Healthy Blue. So that's important when it comes to the primary and secondary insurances as well.
How is the Ombudsman assigned to a beneficiary?
Yeah, so through our phone line, anyone calls in, an ombudsman opens a case for them. If it's a very urgent or complex case, a supervisor usually gets involved, but the first person who answers the call opens a case for someone.
Okay. My child is in Medicaid Direct. He was notified that he would be moved into a tailored plan. How do I find out if his pediatrician will be in the tailored plan? I haven't found that there is much information about the tailored plans so far.
Sure. So I would say the quickest and perhaps the best way is to talk to that pediatrician directly. There are online directories. You can also call to the member services lines I'm not sure which tailored plan this is, but you can call to find out more information. But sometimes the pediatrician may be planning to be in network with them and is working through the process. So sometimes just talking to the provider directly about it is a good way to know.
Okay.
As those online directories, get updated, because there probably are changes happening to them all the time.
Oh, Sean, I know. He says maybe I need to look over the
Oh,
slides sometime when I'm not too tired. I still don't get this.
I'm,
Look,
s-
don't feel bad, right?
it's a lot. So I can tell you that our monthly webinar, we start with the same slides every single month, and we don't get many complaints about it being too repetitive because we know it's a lot of information to digest. If you think it would be helpful to talk on a one-on-one basis, definitely reach out to us. This is a new system that we're all navigating together.
Someone has asked, my daughter has multiple disabilities. Could you give me a recommendation about what plan I should pick? And probably without knowing the details, well, go ahead, Christy.
So I can't do choice counseling. So I want to make sure everyone knows that the enrollment broker does choice counseling.
And I will put in the follow-up email, I will put information about how to contact the enrollment broker.
Yeah.
They can help you make choices. That's good to know. Also, do medically fragile clients continue to fall under the IDD category?
I would need to get back on this one. I will make a note on this one. And are you asking, are they going into a tailored plan? Is that the kind of follow-up question on that?
It's going to continue to fall under. Yeah, I think so. I don't, well, medically fragile children in general don't all fall under IDD necessarily. So it depends, right?
Yeah, I don't want to give any bad information on that. So I would like to follow up on that one.
All right. Can the tailored plans assist with getting assistance in the school setting, like with an IEP or implementing doctor's requests for a child at school? Well, Akila, if you need help with IEPs, so the Exceptional Children's Assistance Center does just that. So when you get the follow-up email, I'll put our information and feel free to reach out to us, and a parent educator can help you navigate that.
Thank you for taking that one.
My children have weekly appointments, would need to fill out a form for each appointment. I guess that's for the transportation.
Yeah, so I've helped people who have standing appointments. I'm not sure if that's what's going on here, but if someone has a standing dialysis appointment, for example, you can schedule standing appointment requests. So that's just definitely a conversation to have with whoever handles your NEMT. Again, this is for Medicaid covered services to a North Carolina Medicaid provider.
And then Ashley said, and yes, 10-1, does DSS continue reimbursement? So I guess if you're in a tailored plan,
you would go through the tailored plan.
Uh-huh.
And I know before this delay, there will be a new timeline. There will be a date before 10-1 where they will, I'm expecting this based on previous timelines. There will be a date where you can start scheduling NEMT with the tailored plan before the 10-1 launch. So that will be important to watch for.
Okay, and we have just a few more minutes.
Sure.
If y'all would do me a quick favor, audience, I am going to launch a quick evaluation poll. and our organization is largely funded by grants. That is how we are able to provide our services at no cost to families. Our webinars, our one-on-one support, all the things we do for families are completely free and at minimal cost for professionals. So in exchange, we need the evaluation data. So if you guys would not mind, please filling that out. It's really quick. Thank you so, so much. We want to continue to be able to do this. Let's see. For the innovations waiver, is there any way to find out where my children are on the list?
We usually connect people to their LME MCO. That's not an area that we work in super directly as far as maintaining that list. I don't know if other Christy has more guidance on that.
Other Christy says, yes, you can call your managed care organization and ask them. They're not going to say, hey, you're number 5, but they'll let you know like what year they're offering, as far as I understand. They could say, yeah, we're offering people slots that got on in 2005 or whatever. They're not going to say you got, or maybe they can tell you what number you are, but they're not going to tell you, yeah, you got 2 more years left, or you got 5 more years left. They really can't tell you how, that specific, but call them and see. And different MCOs might have different policies around how they answer that question as well. Let's see. What is considered an enhanced behavioral health service?
So there are some services that a standard plan offers. So an example I can think is like inpatient behavioral health services. And then there are some enhanced ones that right now are only available through the LME MCO. So that would be like the child and adolescent day treatment services, or I'm trying not to use an acronym. So psychiatric residential treatment facility. That's where I can definitely, a good resource is if someone does the request to return to Medicaid direct form, there's a list of that services on there, but I can definitely provide you with more information and a follow-up, because it's not one answer. There's a chart.
Someone said they received a letter yesterday saying that my daughter's tailored plan will start on April 1st. Will this be postponed until? Yes.
That letter may have been received late, and I would expect, I know delay notices will be going out, but I would expect that would be coming your way soon.
What is a case manager? What do they do? And is it necessary to use one?
If that's about tailored care management, it is definitely, you can opt out of it, but they are there to really help, people navigate their care needs. So addressing both that physical and behavioral health, or IDD TBI side. That's the goal of tailored care management, is to really integrate those. But it is possible to opt out if you are not interested in that.
Let's see, we have just a few more minutes. I'm good to hang out for a couple more minutes if our interpreters are as well. Do you have another 5 minutes, Angie and Christian? Are you good with that? Who can help determine if my child is eligible for any Medicare plan?
So we don't work on Medicare issues. We often refer people to, and Christy, I don't know if you would have more information on this, but if someone's asking us about Medicare, there's the Seniors Health Insurance Information Program that we refer someone to, but as that's the extent we usually get involved with Medicare.
Okay, thank you. Somebody asked how to get help through ECAC, and I put in the website, there's a contact a parent educator feature there where you can fill out an online form and we will be in touch with you. So please do that. Let's see, we'll take, there's so many questions, I really want to answer them all. Is NC Medicaid doing anything to expand its base of service providers? We cannot find dental services for my son because of his disabilities, and services needed and providers will not accept NC Medicaid.
This is a really great question. I can't weigh in on the provider side of things, but I can just reiterate that one of the things that we're here to do is to track issues and monitor trends. And we report those to the state. We do a monthly trend monitoring report. We look for emerging trends. We look for existing issues. So we don't know about the problems unless people reach out to us. So we'll always work to resolve them. But if it's like a provider network issue, even if we still can't fully resolve the problem, it's important for our trend monitoring.
Yeah, even if you, then that's, I mean, same with us. ECAC also monitors trends. And if we don't know about it, we can't do anything about it. And we do end up in spaces where we can do something about it. So please, yeah, if you notice trends, let the ombudsman know, education wise, you notice trends or you have an issue, we're tracking trends, let us know. Ombudsman is a mouthful. Are they contracted with Medicaid, or how did they get involved with all of this?
Sure. So our program came into existence, before the launch of managed care, when it was decided that North Carolina was going to move towards a managed care system. And we're meant to be the beneficiary advocate as this system changed to managed care, through that trend monitoring and just through informal issue resolution. So it is a contract through North Carolina Department of Health and Human Services, but we are that advocate program. We provide confidential services, we provide issue resolution. People who are not familiar with ombudsman, I usually just use the tagline that we're your advocate.
Okay. All right. So unfortunately, we are going to have to wrap up tonight because we were scheduled to go to 8:15. Yeah, Christy, we definitely want to have you back.
Yeah, I would love to come back. I know some of this right now, with the delay, some of the information is changing, what I would be able to talk about tonight, but I would love to come back in the future. I encourage people to reach out to us too, because sometimes the issues may be very specific and it's really best to talk on a one-on-one basis.
I see that somebody had an issue with the evaluation, but it was a poll that should have popped up. But if it didn't for you, that's totally fine. Don't worry about it. I can see if I can send it in the follow-up email, but I'm not sure if I can send a Zoom poll in a follow-up email, but thank you. I appreciate that. Christy, thank you. Thank you to our interpreters. I appreciate you guys so much helping us make this webinar accessible. And Christy, definitely want to have you back sometime. Thank you so much.
I may call you for some of your expertise in the future.
Do it. We help each other. That's how we do it. Y'all,
Right.
you get a follow-up email in the next couple of days with a link to the recording and the slides and some of the follow-up information that we talked about, including Amy's trying to help people about the poll. Thank you.
Yeah.
All right, guys. Have a good evening.
Thanks, y'all.
Bye-bye.